Have you ever really thought about that tiny pill you swallow? It seems so simple, right? But it's actually the hero of this incredible epic journey. In this explainer, we're going to follow that pill from the moment it's created in a lab all the way to its final critical mission deep inside your body. It's time to uncover its secret life.
I mean, it's a question we've all had. You take it, it disappears, and then, you hope, you start to feel better. But the path it takes to get there, it's like a crazy obstacle course, one that's designed to test its strength, its purpose, and most importantly, its safety. So, what really is that journey?
You know, before a pill ever ends up on a pharmacy shelf, it has this long and incredibly demanding origin story. We're talking about years and years of development and testing just to prove that it's not only going to work, but that it's safe. This whole journey is overseen by the FDA, and believe me, it is one of the most rigorous processes in all of science. And that road to approval is so methodical. After all the initial lab work, the drug finally gets to human trials, which happen in 4 very distinct phases. First up, phase 1. This one's all about safety. They give tiny doses to a small group of healthy volunteers just to see how the body even handles the stuff. If that checks out, it moves to phase 2, where they give it to a couple hundred patients to get the first real clue. Hey, does this thing actually work? Then comes phase 3, which is the big one. We're talking thousands of patients to confirm it's effective on a massive scale and to watch for any common side effects. And even after all that, after it's approved, the journey's not over. Phase 4 is basically long-term surveillance, watching for any rare or delayed side effects that might pop up years down the line. Let's just stop and think about that number for a second. 2,000 patients in a single trial. This is not some small focus group. This is a massive, multi-year and unbelievably expensive undertaking. And this scale, it's a huge reason why new medicines take so long and cost so much to develop. It's all about gathering just an overwhelming amount of proof that the benefits of a drug really do outweigh the risks for all of us.
All right, so our pill did it. It passed the trials. It made it to the pharmacy. Now, the real challenge begins: surviving your body. The second you swallow it, that pill has to run a gauntlet of some seriously powerful systems that are designed to break down and get rid of anything foreign. And the first, most intimidating gatekeeper of them all? Your liver.
Okay, I want you to meet the body's elite security team, the cytochrome P450 system. This whole family of enzymes, mostly hanging out in the liver, acts like a team of bouncers at a super exclusive nightclub. Their one job is to check every single drug that tries to get in, break it down, and get it ready to be kicked out. They're absolutely essential to how your body processes pretty much any medication.
Now, here's where it gets really, really interesting. Other stuff we eat or drink can totally mess with these bouncers. Some things, called inducers, are like giving the bouncers a bunch of energy drinks. They start working way faster, clearing a drug so quickly that it might not even have time to do its job. A good example is St. John's wort. But then you have inhibitors, which are like slamming on the brakes. They slow the bouncers down, and that can cause drug levels to build up to dangerous, sometimes even toxic levels.
And this is the classic example that just perfectly illustrates the point: grapefruit juice. Believe it or not, it's a really powerful inhibitor of one of the key P450 enzymes. So for certain drugs, like some statins or blood pressure meds, just one glass of grapefruit juice can dramatically increase how much active drug is floating around in your system. It's the perfect reminder of why you should always talk to your doctor or pharmacist about what you can and can't have with your prescriptions.
Okay, our pills survived the brutal approval process, and it somehow managed to sneak past the liver's bouncers. Now it's time for its final mission, to find its one specific target somewhere in the body and do its job. This right here is where the magic really happens. This part of the pill's journey has a fancy name: pharmacodynamics. It sounds complicated, but it just means what the drug does to the body. And honestly, the best way to think about it is with the lock and key analogy. The drug molecule, that's the key. And a specific receptor on a cell somewhere, that's the lock. For a drug to work, the key has to find and fit into its one very specific matching lock.
But not all keys do the same thing. An agonist is a key that fits the lock and actually turns it. It activates the receptor and causes something to happen in the body. An antagonist, on the other hand, is a key that fits perfectly into the lock, but it just sits there. It doesn't turn it, but by being there, it effectively blocks any other keys from getting in and turning the lock. Both types of keys are incredibly useful, just for completely different reasons.
So we've got these keys that turn the lock. But that brings up a really important question.
Does every key turn the lock with the same amount of effort? And does every key open the same size door? Well, the answer is a definite no, and understanding that difference is absolutely crucial.
This is where we get into two super important but often confused ideas: potency and efficacy. Potency is all about the amount of drug you need. So a highly potent drug is like a key that turns the lock with just the slightest touch. Efficacy, though, is about the maximum effect the drug can possibly produce. Think of it like this: how big of a door does the key open once it's turned? A drug can be really potent but not very efficacious, and the other way around.
So here's the main takeaway, the crucial point. You can't confuse potency with effectiveness. Just because you only need a tiny, tiny dose of a drug, that doesn't automatically mean it produces the biggest effect. The goal isn't always to find the most potent drug. It's to find the one with the right efficacy for the job. And this is exactly why the size of a pill can be so misleading.
Okay, so the key is in the lock, it's turned, the door is open, the drug is working. But that leads us to the final and maybe the most critical question of all. How do scientists make sure the dose that helps you isn't dangerously close to a dose that could actually harm you?
Well, the answer is a calculation called the therapeutic index, or TI for short. You can basically think of it as a drug's official safety score. The way they figure it out is by dividing the dose that's toxic to half the population, the TD50, by the dose that's effective for half the population, the ED50.
So, what does that number actually tell us? It's pretty simple, actually. The higher the TI, the safer the drug. A big therapeutic index means there's a really wide margin, a big safety net between the dose you need to get better and a dose that could start causing problems. A low TI means that window is super narrow, and that drug has to be dosed much, much more carefully.
So when you look inside the equation, it's all about the distance between these two key numbers. The ED50, the effective dose, that's like the ground floor. The TD50, the toxic dose, that's the ceiling. And that space in between, that's the therapeutic window, where the drug works safely. The entire goal of pharmacology is to design drugs that have the widest, most forgiving window possible. So from a lab, through thousands of patients, past delivers bouncers, and into one specific molecular lock. I mean, the journey of a single pill is just extraordinary. But it leaves us with this one last thought. Since our bodies, our metabolisms, and our locks are all a little bit different, the future of medicine isn't just about finding better keys. It's about designing the perfect personalized key for every single individual.